how messed up and how derogatory and false and misleading the information about queer individuals in textbooks is. Let me remind you, this is stuff that is taught in the medical syllabus, in our medical textbooks. Doctors have been reading and studying and learning this stuff for decades together, myself included. So, my first quote is from forensic medicine, and this is something I studied in my second year myself. It says, lesbianism is practiced by females who are mentally deranged. They also commit crimes like homicide, suicide, etc. Women of the Isle of Lesbos practiced this perversion. I don't know what century these authors are living in, because in 1973, the DSM, or the Diagnostic and Statistic Manual of Mental Disorders, removed homosexuality as a mental disorder. 1973. In 1990, the World Health Organization removed homosexuality from its list of disorders. This was in 1990. Why are we studying this in 2021? Why? In my final year, I read this in Gynecology. Homosexuality, transvestism, and transsexuality are abnormal sexual behaviors. These are psychosexual patients and need careful handling and a lot of counseling before taking and accepting the individual's decision. No. This is giving me a headache. The Indian Psychiatric Society, the American Psychiatric Association, and the World Health Organization collectively and strongly believe that homosexuality is not an abnormal sexual behavior, and neither is a transvestism. It blows my mind that we're still using unscientific terms like transvestism in medical textbooks. Transvestism basically means cross-dressing. So apparently, if a woman cuts her hair short, that's an abnormal sexual behavior. Or if a man puts on some kajal, that's an abnormal sexual behavior. For God's sake, why are we doing this? This is so damaging to patients and so damaging to an individual's psyche. Transsexuality and gender identity disorder are also outdated terms. But psychiatry textbooks and syllabi continue to use these words, Describe and discuss unnatural sexual offenses like sodomy, incest, lesbianism, buccal coitus, bestiality. It basically puts homosexuality into the same category as having sex with animals. I can't tell you how damaging it was to sit in a classroom and read these things amongst my peers, and for all of them to learn all of this information as legitimate and scientific and objective, and actually get marks in exams by spewing the same nonsense. I had to spew the same nonsense in my Viva sessions. It was humiliating. And the kind of misinformation, for example, for a lesbian woman, it says that a clitoris may be normal-sized or enlarged. Why in the world would the clitoris of a lesbian woman be enlarged simply because she's a lesbian? It also says that in a normal female, menstruation is normal, but in a lesbian woman, the menstruation may be irregular. What has lesbianism got to do with the size of your clitoris and how regular your cycles are? Kuch bhi. Such mental trend of sodomites may have some genetic or hormonal or behavioral factors originated during childhood. Firstly, sodomite, which basically means an individual who has anal sex, is a very derogatory term. It's an insult. And there is no scientific evidence that there is a hormonal or behavioral factor during childhood. That is bogus. And this is exactly the reason doctors practice conversion therapy. They inject gay men with testosterone to try and fix them. They inject trans women like myself with testosterone to try and fix us. They would perform conversion therapy. They would literally give electric shocks to gay people and trans people to try and fix them. And this is not the end. There is so much more of this in our textbooks. And this is exactly why it is so important for us to remove these things, because imagine the kind of harm that this does. Of course, it's very important for us to replace all of this with accurate information about gender and sexuality, but all of this bogus has to go. It's a start. At least the National Medical Commission recognizes that all of this cannot be taught anymore. And I urge every medical student watching this or every doctor watching this, please take this up with your departments. Please take this up in your classes. If this is being taught in your colleges, please don't sit there and accept this as science, because it's not. This has to change.